This portion of New Day Northwest is sponsored by Sound Pain Solutions.
Americans suffer from some type of spine-related condition every day. Anyone who has ever experienced neck or back pain to any degree knows how the discomfort can affect everything you do, from work to play to simple day-to-day activities. Here with a non-surgical treatment for lasting relief are Drs. Kevin Polzin, Mark Shelley, and Vince Leone from Sound Pain Solutions. Great to have you back.
Thank you.
There should be no pain at all with the three of you, right?
That's right. Feeling good.
Okay. Dr. Leone, let's start. What are a few of the conditions or symptoms that someone might have related to chronic
Sure, yeah. So typically the conditions are obviously chronic in nature, so it's degenerative joint, degenerative disc, stenosis, bulging disc, herniated disc, and then symptoms-wise, obviously pain, right? And that can be sharp, dull, achy. We can have numbness, tingling, weakness, and a lot of times these conditions are in the lower neck or the lower back. And so there's so much pressure on the nerve root that it will actually send pain, numbness, tingling down the arms, down the legs, sciatica, and it affects strength. It can even cause, tripping, stumbling, that type of stuff.
And sometimes where the pain actually, where it's coming from isn't what you're feeling. You could be feeling it in somewhere else.
Absolutely. Right. What we call referred pain or symptoms.
Okay. Dr. Polzin, what are some of the main treatment options then for this kind of pain we're talking about?
Yeah, so at Sound Pain Solutions, we focus on a most conservative first basis, and yet we refer out for other options because there really is a time and a place for every medical treatment. Your standard medical treatments would be, as you would imagine, drugs like painkillers and muscle relaxants, physical therapy, injections, and surgery. We focus on a most conservative basis first because the statistics around those treatments are actually quite alarming. United States...
Jumping to surgery first.
Well, or, in the United States, we have 5% of the world's population, yet we consume 75% of the world's opioids.
And don't we know that here?
And we know that, right? Studies have shown less than 5% of back pain actually requires surgery, but neurosurgeons perform over 1.5 million surgeries a year.
So at Sound Pain Solutions, you want to wait on the opioids, wait on the surgery until you've exhausted the other
absolutely.
options.
Most conservative first. And there's a great population of people that are looking for a long-term solution without drugs and without surgery, and Sound Pain Solutions provides that.
Okay, Dr. Shelley, let's talk about, actually, I love this cool prop. Is this my spine?
With this cool prop. Hopefully this is your spine.
This is how we're going to treat it. So what are we seeing here?
So what we're seeing, this is the vertebra. So we have two vertebrae and we have the disc, that pad that's in between the bones.
Okay.
And here's showing normal joint motion. So this is healthy. We hope that's where you are and where you stay.
Depends on the vertebrae, but...
For most of us, that's the case. The second level is showing the disc is wearing, so we're starting to get deterioration taking place. The third level, I'll hold that up, is moderate to advanced wear or degeneration of the disc. All this here, this additional white, that's arthritic development. And if you look at the side, this red bulge you're seeing, well, that's a herniated or bulging disc. So from the top, we see the outer fibers, which are really tough cartilage material called the annulus. The inner part, when we're young and healthy, is jelly-like, it's gelatinous. So if the outer bands, if they weaken, then the disc can start to bulge and create compression to the nerve. That's what you're seeing here in yellow. So this is
trouble.
Well, this is
That's
trouble.
pain.
This is end of game. This is the 5% based on the research that probably need to have surgery to resolve the problem.
We want to get to it first. So, and as far as treatment goes, I think we have some video to show of that treatment, and then we have this cool one.
So
what are we seeing here?
So what we're seeing is patient Paul and Laura Lynn, our decompression tech. So she's putting him on the decompression table and then lowering. If a person has pain, sometimes getting on and off is hard. She's putting the harnesses on because it attaches, it holds at the ribs and the hip, bolsters supporting the legs. And that's Paul. You notice he's not screaming in agony. There's no pain. There shouldn't be pain at all in the process. She's entering the computer program then that's controlling it.
And this is not only taking pressure off those discs in the vertebrae, but then the treatment part as well.
Let's walk through
What's
that.
it doing?
I think the best way to explain, we'll use Paul because he's such a great example. He's a truck driver. One day he was pulling on a pallet like crazy, 1,500 pounds loaded on it. herniated the disc. So on our model here, when that disc bulges, if it's putting pressure into the nerve, it's incapacitating pain. He literally was requiring assistance to be able to walk.
Wow.
So treatment procedure in the initial stage, and we're going to talk about 3 different stages in treatment. But first of all, it's all about reducing pain, reducing compression, reducing inflammation. So a typical treatment procedure, like with Paul, what we did, we used non-force adjustment or mobilizing procedures first. If these joints are locked up, if they can't move, then we can't decompress the disc. So we're restoring motion. Then we go to the machine that you saw, the non-surgical decompression machine, and it's creating a vacuum inside the disc, so negative pressure in the disc, and that draws the protrusion back in. The medical treatment would be to go in surgically and remove that, what's called a discectomy, to cut away that protrusion. So fortunately in 1991, a neurosurgeon invented non-surgical decompression, using the machine to create that vacuum, reduce the protrusion.
Makes sense to try that first.
Absolutely.
So,
Absolutely.
Dr. Paulson, how can people find out if they're actually good candidates?
Well,
for
we
sound
make
pain
that
solution
as
treatment?
easy as absolutely possible. In fact, they just call Sound Pain Solutions, and any one of our Puget Sound offices will provide a complimentary consultation to rule you in or rule you out as a good candidate for a non-drug, non-surgical, long-lasting relief from neck and back pain.
I bet you give a lot of people a lot
We
of
do.
joy they thought
Every
was
day.
missing. I like this idea. Thank you so much. For a free consultation or to learn more about Sound Pain Solutions non-surgical spinal decompression treatment for chronic pain, please call the number on your screen.